Welcome back. This is the Ben Shapiro Show. Well, the crisis on the border continues to gain steam as House Democrats militate against a bipartisan bill passed by the Senate today that would help alleviate some of the conditions on the border. Joining us on the line to discuss, Senator Bill Cassidy, Republican from Louisiana. Senator Cassidy, thanks so much for joining the show.
Hey, Ben, thank you for having me once more.
So, Senator Cassidy, can you please explain the bill that was passed by the Senate today, and why isn't Nancy Pelosi just passing it?
Yeah, so we're going to ship dollars down there to give the federal government the ability to meet the humanitarian crisis. It also allows communication between the border folks as well as Health and Human Services. That kind of makes sense. If you got a bunch of people that need health care, you want to let the healthcare agency know that they're there and have some sort of interchange of information. House Democrats do not like that. Anything that would make our federal response more efficient and effective, they think would further the aim of sealing our border. Now, you and I might think that's a good idea. They clearly do not. But I, as a doctor, would say you really would like to have communication between the two agencies because you'll have better health care.
So the fact that Democrats in the House continue to complain about the border while doing pretty much nothing to help alleviate the conditions, it's pretty astonishing. I mean, it's pretty obvious what they would like is for the asylum bottleneck to continue, specifically so that people are by law forced to be released into the interior of the United States, at least Democrats in the House.
And there is a certain body count that's going to happen. There's a certain amount of mortality that will occur as long as there's this big magnet of an open border that people can come from. Caravans will continue to form. So now, the left may say, oh, isn't it terrible that we have these terrible conditions? I absolutely agree with that. But when you have 100,000 people coming in a caravan, or tens of thousands, but cumulatively 100,000 people coming across the border, you're going to have a difficult time handling those folks. And there are going to be people that die. It would be much better if there was an ordered way in which to process. The left should recognize that if they really care about the humanitarian crisis, part of that is ending the magnet that an open border has become.
Well, shifting topics a little bit, tonight is the Democratic debate. I expect that the first Democratic debate will feature every Democrat on stage ripping into President Trump, suggesting that it's Republican border policy that has led to this problem, despite the fact that 5 minutes ago, they were all claiming there was no crisis on the border. It was all manufactured and all made up by President Trump. What do you expect to see in tonight's debate regarding immigration?
Yeah, I think you kind of summarized it. Isn't it curious? It was manufactured, according to the left, about a month or two ago, and now it's a crisis which must be addressed yesterday. Now, by the way, I agree it's a crisis, but it should have been addressed 2 months ago. I'll also point out, Ben, the New York Times was writing editorials calling out Democrats for doing nothing on the border. So hopefully they will acknowledge that there is a problem, that we should do something to secure the border, take care of the people there, by golly, got to. On the other hand, cease to make it, again, as I said earlier, the magnet of an open border. Hopefully they spend more time attacking themselves, but that may be wishful thinking.
Well, Senator Bill Cassidy, Republican of Louisiana, obviously tonight we can also expect some talk about health care. This is sort of your domain. The fact is that the Democrats have been moving radically to the left on health care. Medicare is one of the great drivers of America's national debt. Medicare and Social Security alone will basically be driving the entirety of America's national debt over the coming decades. By the year 2039, 2049, within the next 30 years, basically America's national debt will represent 144% of our GDP, largely driven by Medicare. Democrats' solution to this is to expand Medicare to include everyone. How exactly is this supposed to work?
Well, a couple things. The left is now acknowledging that Obamacare does not work. Now, they don't really want to say that, except when they speak of Medicare for All, that is effectively what they're saying. And at least they used to have the fig leaf of hypocrisy, where they would say if you wanted to keep your insurance, you can. Now they're effectively saying, even if you're happy with your employer-sponsored insurance, sorry, you're going to lose it, because we're going to take that away from you and force you into Medicare, which, as you point out, is going bankrupt in 8 years. So we're going to put 150 million people into it, and it goes bankrupt in 8 years. Medicare for All is Medicare for none. That's going to be the point. Now, how it works, I'm not really sure. They've avoided the kind of sticky details like how they're going to pay for it. A small thing, $32 trillion over 10 years, how do you pay for it? We'll get into that detail later. But what we do know is they would have to double taxes on individuals and corporations, and according to Bernie's original plan, they would decrease provider payments, say doctors and hospitals and nurses, by 40%. So you double taxes and you decrease provider payments by 40%, and somehow the system's going to keep on working. I just don't get it, but that's their plan.
Yeah, Bernie Sanders has said that he won't just restrict this to American citizens. When he says Medicare for all, he means Medicare for all. He wants Medicare for illegal immigrants as well. So presumably we will be covering a bunch of people who are barred by law from paying federal taxes. And yet somehow, magically, this will all be made up for by what? Yelling at Wall Street while eating pudding? Like, how exactly is this going to work?
I'm not quite sure, but I did my medical residency in Los Angeles at Los Angeles County Hospital, a hospital for the poor. Most did not pay anything. And we used to get patients from all around the world, from Armenia, for example, and they would have a heart problem. They would land at the airport. They would come straight to the emergency room. They'd admit themselves with chest pain, and they'd have their operation for their heart, and then they'd fly back to Armenia. Folks who come from Mexico with notes on them from the doctor in Mexico, patient has this condition, please treat. Now, I'm not making this up. This is, this is the reality of that hospital. And so in Texas, I once did some time at Galveston. And at one point, Galveston, the University of Texas Medical Branch at Galveston, had to make a decision not to do elective procedures for folks from Mexico because they were coming up just to get free care and go back to Mexico. Now, what we're about to find out in California, where they're going to extend Medi-Cal or Medicaid benefits to folks here illegally, is that will be a magnet. And people will come here specifically for health care. And those American citizens who need health care will have less access because scarce resources are being given to people who are here illegally. I'm a doctor. You come to see me. I don't ask you your immigration status. I treat you. I do my best. I spend whatever is necessary. But on a public policy realm, when we have Americans who don't have the health care they need and taxes that are too high for many, to kind of make that worse by giving free health care to those who are here illegally and perhaps come for free health care, that's wrong, Ben.
Well, we're speaking with Senator Bill Cassidy, Republican of Louisiana. So tonight, we see clown car number one of the Democratic candidates. There's some 1 million candidates on stage tonight. That's followed by another 1 million candidates tomorrow night. They're hoping that from among these 2 million candidates, one will emerge who can beat President Trump. What are your expectations for the debate tonight? It features Elizabeth Warren, who's been gaining a lot of steam, Senator Warren, who used to be a lot more moderate before she ran for the Senate. I mean, I knew her back when she was at Harvard Law School, and I remember when she was in favor of school choice and when she talked about the middle income problems, and she was a lot more moderate on a lot of these things. So she is the front runner, and she's on stage with Bill de Blasio and Cory Booker. So all the luminaries who can't break 3% in the Democratic primaries. What do you expect from the debate tonight?
Well, I think it will be kind of fun. I'll listen to it as I walk my dog. It's just going to be each of them trying to be even more crazy than the other to get the attention, but to get attention among a bunch of people who, as you said earlier, will be bashing Trump. You have to really be out there.
Yeah.
So I'm just trying to imagine just how far out there they will get. And I'm hoping that the American people who are not on the hard left will see this and just shake their heads and say, maybe President Trump's not my cup of tea, but this is not what I want.
Well, I mean, there could not be a field better calculated to do that for President Trump than this particular one. Senator Cassidy, thanks so much for stopping by. Thanks for your hard work in the Senate. Appreciate it, sir.